What's going on, everyone? Hey, I'm sitting here in a consultation room with Dr. Zach. Say hi, Dr. Zach.
How's it going?
And Dr. Zach did a bunch of training with Paul, and did you do it with David Markarian?
David as well.
And David Markarian as well a couple weeks ago. We got MyoVision in our practice. We have all the stuff from MyoVision. So we can do digital range of motion, we can do range of motion with surface EMG, and we can do the surface
EMG.
static EMG.
Yeah,
static
static.
EMG. And anyway, how's it going, Kaylee? Hey, look, it's Kaylee.
Hey, good to see you.
Kaylee, why aren't you working? What are you doing? All right, so anyway, Kaylee, working. Come on, we caught you. We caught you. All right. So anyway, how this works is Dr. Zach's running through this with me because he went through all the training, and I have not gone through the training, so he's training me. And I said, hey, we should do a Facebook Live real quick and pull this up. So he's showing me, can you flip it around, though? Can you put normal on the left and then the patient on the right? And then are you able to move it up a little bit so it hides the name of the patient so it goes off your screen?
That might be.
You know what I'm saying? He's going to prepare this a little bit. Kaylee, headache times 1,000. Kaylee, I think you got less headaches when you worked at Gonstead Spine and Wellness. I think you're getting more headaches now that you work in the medical model. I think they have drugs for that. Just joking. Now everyone, Kaylee used to be my scribe, my assistant, before she abandoned us right before the COVID crisis, and I'm sure every day she regrets that choice, but I don't know if she wants to admit that or not. What do you think? You think she regrets it?
I think she does.
Yeah, I think so too. All right, anyway, we're gonna flip this around. Are we good to show it?
Because now there's nothing there.
Okay, all right, so,
Make sure there's nothing.
all right, walk us through. I'll hold the camera steady.
Okay, so there are 3 components to MyoVision.
Well, hold on a second, let me just explain. Why is this important? Because it quantifies and shows if someone has a dysfunctional pattern, if they're injured, and it holds up in court, and it's also in the AMA guides for range of motion as far as the digital range of motion piece that MyoVision does. So it's legit, and some of the attorneys we work with actually ask for this because they worked with it in the past. We decide to pull a trigger and do it, have a more objective way of measuring range of motion, be able to have more objective findings in all of our patients, injured patients from car crashes and work comp, obviously is a priority to have that documentation there. And we're going to eventually build out some range of motion stuff with it in the MoveWell 3. So we do our functional movement test, we can take some MyoVision digital range of motion, have it record that. So that's on our list of things to do. Let me flip this around.
All right, so there's 3 components to MyoVision. Bottom row, we have range of motion. So this shows the degrees of range of motion at each repetition.
And real quick, on the left you have normal.
This is normal. I'm going to go over first, and then we will go over abnormal second.
Which is actually a patient of ours that went through this.
Yeah.
Okay.
So on the first range of motion, we're having them do flexion. So this is where they would record the motion 3 times. So you can see neutral, flexed, go back to neutral.
It's got a little picture there so you can just follow along. You know what the patient's doing while it's reading. And so basically we have EMG leads on their cervical paraspinal muscles. That's what CP stands for, and SCM, which is your SCM muscle in the front. So you have 4 leads, right? 2 in the front, 2 in the back. And then the bottom one is actually just showing range of motion.
Yes.
Okay.
Bottom one is showing range of motion.
Cool.
Correct.
All right.
So as you can see, this is a perfectly performed movement. They have a peak here, stops, peak there, stops. Now we're going to look at what the muscle is doing with the SCMs. So whenever you do a movement that requires both muscles on each side to perform the same function, then the lines should match, which means the red and blue lines should be the same.
Because you should be firing at the same time.
Correct. So at number 1 is where they're at full flexion. When they're at full flexion, ideally normal is where they're completely the same. Red and blue lines match. Then as you go down to marker 2, this is where they're coming back to neutral. When you're coming back to neutral, your SCM should not be firing, so you should reduce all of that muscle activity, going back to flat.
So essentially going from flexion into extension, so you are extending. When you extend, you should reciprocally inhibit the cervical flexors, and the SCM should be really silent at that point.
Correct.
Okay.
Then you go into the second range of motion, same thing, go to a peak, both should match. Go to 4, this is where you're relaxing, so this is where you go back to neutral, should be flat, and then when you go to your third range of motion, there should be a peak, and then it should relax.
Okay.
This line goes all the way down, so this shows all 3 motions where it's at full flexion.
And the whole reason that it starts so much higher on line number one,
That it's just the normal.
It's just the starting point.
It's not really a.
It's not significant.
Yeah.
Okay.
So now we're going to go into the patient that we had. So, ideal normal for flexion is 50 degrees. She's at 53. So, in terms of range of motion, she does not have an issue with range of motion. She meets the AMA guidelines.
So this is a perfect example of how someone would just go to like an independent medical examiner. They do range of motion and they say, "Oh, your range of motion's fine. You pass."
Yep. So, first, we're looking right at number 1. This is right where they're at full flexion. The lines should be matching. You can see here where there's a little bit of a gap in between there, which is probably a mild finding and where her muscles are not firing at a proper pattern. You can also tell that on the left side, where the ideal is, there's a peak to it. You can see here she does not follow that typical pattern where it gets stronger and then relaxes.
So it's basically showing that her cervical paraspinals are just like constantly have some level of tension or contraction.
Correct.
And then as she flexes down, the cervical paraspinal should turn off. They don't. They stay active. And as she flexes down, the SCM should shut off, and it.
So when you go into flexion, both should be firing.
Turn on. Yes, sorry.
So both should be firing.
I'm just looking because these are further apart than these, but that's just because it took longer for her to get through that.
Yep.
Gotcha.
So on 1, this is where she's at full flexion. At 2, this is where her body should be relaxing because she's going from a flex position to an extended position. Mm-hmm. So these should be having relatively no muscle activity. But you can see there's a big separation here, and also her left paraspinal or her left cervical paraspinal musculature stays activated. So it doesn't relax. This is an abnormal pattern. And you can see here, she has to actively contract her SCM to return back to normal, which is abnormal as well. This should be fully relaxed.
Okay.
Then we go into the second range of motion where she's in full flexion. Lines match perfectly on SCMs, gap between the cervical paraspinal muscles. So this would be a moderate or a mild finding right here. Then you can see her relaxation phase, she peaks, which means she tries really hard to go back into neutral. So she's here, and then to bring yourself back up to neutral, you should have no muscle activity on the front. And she is actively extending back, which is abnormal. That could show some type of cervical instability, it could show a sprain, or it could show an abnormal muscle firing.
So you're saying that when she's extending back, her SCM is firing or her cervical paraspinals?
So both. She has her SCMs because they're not relaxing, they're still coming up. And then especially her left side, which I believe was her issue, is really firing. And it's constantly firing and gets stronger as she comes back up.
And technically, when you come back up, it really shouldn't take all that much muscle contraction.
It should be basically like a spring-loaded thing where you come back with no effort.
So like very little muscle contraction with coming from a flex position back to neutral.
Correct.
Okay, interesting.
Okay. And then third range of motion, which is the primary one that you want to look at. And you want to compare the first, the second range of motion, and the third range of motion. And you can see how it's all trending up, which means with movement, she gets worse. This means that movement makes her a lot more aggravated as she goes through that, which shows that she has an irritation to those areas of her SCM and her cervical paraspinals.
Okay.
Cool.
Cool.
Want to go over more?
Yeah, okay, so that's flexion.
That was just flexion.
Cool. And then we also have, I'll flip this around so you don't show the name as you're getting it all set. So that's flexion, and then you're also doing rotation and then lateral bending, right?
That's fine. You won't see the names. So, yeah, you do flexion,
extension,
lateral bending, and rotation.
Okay, let's go to extension now.
Okay. So, same thing. Extension, both muscles should be firing at the same time, which means both lines should match.
Both cervical paraspinal muscles.
Okay.
But SCM should be relaxed.
Both should be contracting is the way that they show these leads.
They're saying both SCM should contract as you extend?
Both SCMs should contract and both paraspinal muscles should contract when you go into extension.
Okay.
Then, second range of motion when you're at neutral. So when you're going from extension to neutral,
and it's
relaxed.
Yeah, and it's not a strong contraction, so it might just be like a stabilizing type of...
Correct.
Okay, because obviously your SCM is not a cervical spine extensor.
It's a flexor.
Yeah.
Correct. All right, so let's go into the patients. So range of motion 1, red and blue lines are matching correctly on SCMs. But now we look at her cervical paraspinal muscles.
She's way more contracted on her left, which is blue.
Yep. And something I like to do as well is go back and check to see what was more active on the first range of motion as well. So in flexion, left was higher as well. So you can tell that she's chronically activating that left more than she is the right. Okay, so you can see the separation there, which shows that there is a difference between the left and right paraspinal muscles. That's not good. This is probably a moderate finding, moderate to severe finding. Then she should be going into relaxation, which she does a little bit with her right, but her left stays contracted.
And just to interrupt, the whole mild, moderate, severe, that's based on how much of a difference there is in a percentage?
Yes. So let me go into that. Let's say you have a perfect little peak right here. Red and blue lines match, that is normal. Let's say the red line went to about here. That's about 25% of this peak. So like 25, 50, 75.
So it's more of a 25%.
And 100%.
More than 25% difference.
So if it's a 25 or less percent difference, it's a mild finding.
I see, okay.
25 to 50% difference is a moderate finding, and anything above 75% is going to be a severe finding.
How about 50 to 75%?
It's kind of dealer's choice. It's kind of like moderate to severe.
Jeez. All right. All right.
So if red line was right here and blue line was there, that would be a severe finding. Now you can see how our muscles go into relaxation at this point with our SEMs, which is a normal finding. Then we go into the second repetition, which is a little bit more separation there. I wouldn't say it's too much. That might be a mild finding.
Oh, sorry.
Okay. Relaxation, and then same there. Okay. So moderate finding on her cervical paraspinals, normal on her SEMs. Range of motion is significantly reduced.
Okay.
Cool.
I mean, not cool, but yeah.
All right, now we're going to left on both. Okay, this is normal. This is her. She has limited range of motion. She should be at about 45 degrees. She's only at about 30 degrees, so she has a much harder time going into left lateral flexion. Then you can see these are completely separated. Now there might have been a problem with the lead when it was attached to the back of the neck, or this could be fine. I'd have to investigate a little bit more. SEMs, one is firing opposite because as you bend to the left should contract more, the right should be inactive. So the left is the blue, the red is the right. So this is a normal firing pattern. Blue should be active, red should be inactive. Left should be firing, right should not be firing. Then relax. Now we go into full contraction. This is right where she's doing the left lateral bending, right here. And then there's a good separation, so that's a normal finding. Good separation, normal finding.
I am missing a CD. Brandy said you wouldn't know where it is from Mark Young.
She had it up at the front. So.
Okay, you don't know where it might be.
Yeah.
Can't find it. Okay.
We're good. All right, so left, significantly reduced range of motion. And you can see that normal firing pattern on SEM, but abnormal firing pattern on cervical paraspinals, or her lead came loose on the left side. On the right side, sorry. Let's go to right lateral flexion. Okay, normal, these are normals. So peaks, now you notice the reds are high and the blues are low. This is what normal should be. Now we look over here. First repetition, she could have done it incorrectly, but it looks like here this was a normal firing pattern, so this shows that both were active. This would be a severe finding right there. And you can see at the third range of motion, both are the same, which it should not be. That's a severe finding. At 5,
wait, so how come it's severe? Why is it severe?
Because you want to be separated.
Separated.
So this peak should be here. So you see peaks, right?
But
because the peaks are afterwards, so that's not normal.
The peak should be on the number 1 when she's in right lateral bending.
Yeah, so these are severe findings all right here because they all match.
So basically, when she's starting to come back to neutral, she's right laterally flexed. She starts to come back to neutral. Her left's gonna fire to bring her up.
But that's not what it shows. It shows that her left is bringing her back into a neutral position.
Isn't that normal?
No.
Why?
You should be, it's kind of that spring-loaded thing. So when you come over here, you shouldn't forcibly bring your neck into that position.
Okay.
You should
Got
relax and let your body go into that position. She's
Okay.
forcibly bringing her neck back into that position, which this is a learned guarding response or a severe finding. Both of them are present.
Okay.
Like this.
Got it.
And then I'm assuming the lead came loose, which is why there's separation from both of these.
Darn. Okay. Yeah.
All right, now we have rotation without range of motion. So we have them perform this just because you can't do it from a gravitational standpoint to hook up range of motion. So you have them sit here, rotate left, rotate right. So this is showing muscle activity and firing. These are oppositely opposed muscles, so when you turn to the left, the right should be deactivated. So this blue line should be high when you turn to the left, and the right line should be low. You can see how the right line is, the red line is firing, which is the right side. So both of them are firing at the same time, which is improper. This would be a moderate to severe finding, because the lines should be flat and a hill. It does go into relaxation, which is good. Then we see up here on cervical paraspinals, there is a separation, but it's not as big of a separation, so I'd consider this a moderate finding, and then this is getting bigger, which means it's getting worse, so a severe finding.
Okay.
Then right rotation, it's going to, so this is normal, this is what we have here. These are good. These have good peaks. They're all at the same height.
So that one on the top, you think the lead came loose?
Probably. That's what it looks like. This is the first time I've looked at this study, and this is one of the first studies.
This is one of the first ones we did, yeah. So in the future, you'd identify that while we're doing it and go, oh, we're going to stop this. We got to fix it.
Exactly.
This one, we're like, we don't know what we're doing. we're just gathering information, waiting to see. They're like, there's a pretty line. Keep going.
So in terms of the SEM, this is much closer there, which maybe I pressed the button at the wrong time. So if I pressed the button here, it might have been that same pattern. We don't know because we don't have range of motion on that one.
Okay.
Now we go to the one with range of motion. So typical range of motion should be about 80 degrees. So you're significantly less on left rotation. She's only about 60 degrees. So again, they should be opposite patterns. Blues, which are her left paraspinals, are always active more so. And there's a decent separation, but see how it's about 50%? I consider that about a moderate. If the red line was here, that would be normal. And you can see how she activates her right paraspinal to come back to neutral. So that's a learned guarding response that you see from here. So this is a moderate finding with a learned guarding response.
Got it.
Okay.
All right. Is that everything?
Last one. Okay, this one's bad. All right, so you should be opposites on this, and these are completely matched together. So these are severe findings.
On right rotation.
On right rotation. And then also the opposite muscles are firing. So she should be firing her left SCM primarily, and she's firing her right SCM instead. And then you can see here as well, she's firing her right SCM instead of her left SCM. So these, and then opposite up here. So she has a lot of learned guarding responses on this range of motion.
Yeah, and this is someone who came in right after a car wreck. It was super acute, could barely even move. She's done months of care. She's gotten better, but she's still not as recovered as we'd like her to be. We think it's just going to take more time, and she is making slow progress and steady. But perfect example, this is now objective data you could use to show to the insurance company to say, look, she's improved, but she's still not normal, even though her range of motion and a couple of these are normal, other ranges of motion not normal, but more importantly, functionally, she is far from normal. So she needs more care, she needs more time, and she's not recovered yet.
And it teaches you on what muscles are firing and which ones should be firing, and then how we can help that patient further. So it's also a diagnostic test for us to know what muscles we should be working on, and then how to be able to improve their function.
Whether it's a muscular issue or a guarding issue because there's lack of stability, or there's still an injury at a disc or nerve root or facet or some other structure that's causing the guarding.
Something she didn't have, which usually in a patient who has like a jagged line, that usually indicates an acute phase. So somebody who's in the beginning stages, or they just re-injured it. So you'll see a jagged line like this.
Oh, like ratcheting.
Yeah, like ratcheting. So she doesn't have that, but on some patients you will see a ratcheting, and that signifies like an acute injury.
Hey, Heather's watching. Hi, Heather. Hi, Heather. Look,
Okay.
proof that your husband is at work. Okay, he's working.
I'm here.
Good job. We're so proud of you, Dr. Zach. We love you, Dr. Zach. He just helped me move a bunch of boxes, too.
I did.
He did. I nominate Dr. Zach for president.
No.
Okay. All right, we're out of here. Thanks for covering that. See you, everyone. Bye-bye.